Last question. I'm asking for a friend. Are you single?
I plead the fifth.
What the hell does that mean?
That's the fifth amendment. Mommy kake home once bonnet another thing.
Oh, Debbie, I'm like, okay, so
I never got used to the routine there. I just was enduring. That's the word. I was enduring in the care home. I wasn't enjoying at all.
But say your truth.
One of the regrets that I made in life.
Really?
Going to a care home, yes. And a alarm that you pull, and you get help right there within. But back in Ghana, you have to just scream or just have to call out someone. No, when you get pregnant, I'm a man, so I'll not get pregnant. But when you get pregnant.
Happy to be here today, Danny. I'm happy to have you here on the channel. Can you please tell us your name and then something little about yourself and your nursing career?
My name is Daniel Frimpong.
And where are you originally from?
From Ghana. Okay,
and how long have you been in the UK?
That's 2 years and 6 months approximately.
That's nice. And where did you school in Ghana? What did you do? Where did you work? Tell us something more about your career back in Ghana.
Okay, high school is my senior high school. I attended tertiary education at Sunyani Nursing Training.
That's nice.
Yeah, and I've completed in 2014. Okay. I started work at Sunyani Municipal Hospital. That's 1 year mandatory rotation. That's Sunyani Municipal Hospital.
Okay.
And after that, I started my permanent posting at Wemfie Government Hospital. Okay. So I worked there for about 1 year and 6 months, and then I relocated to UK.
I know you from Envertize OSCE, and I'm sure if anybody has watched my video about agencies, or I mentioned your name that you helped me with my OSCE preparation. And once again, I want to say thank you very much. And how is it going now? Like, how did you suddenly become the OSCE tutor for Envertize, and how are you able to help people? Like, how did that all come about?
I started my role with Envertize back in Ghana.
So you came with Envertize to the UK?
Yeah, I came with Envertize.
Okay.
And I started my career with Envertize back in Ghana. I was working for the manager for Envertize, that's Fabian.
What kind of work were you doing for him?
I was helping out with CBT questions. I was answering some questions for people in the group. And later we developed the app, the CBT app. Oh. So I was helping with the questions. I was typing the questions and answering them as well.
That's nice.
I later changed roles, and when I came to UK, I was helping with the OSCE group, but because of time factor, I just stopped with the OSCE because I couldn't have time for myself as well.
So now you don't help with the OSCE anymore?
No, not really. I'm very passive there.
Okay, but the group still exists?
Yeah, the group still exists.
So if there's anybody watching us who needs your help for OSCE, or who needs help with OSCE preparation, what advice would you give?
OSCE, you don't need to be scripted. When you come to UK, then you can start your full preparation, but you can just read something before you come in. But when you come to UK, that's when the preparation begin. But there's so much pressure when you come to UK as well. So you need to plan your time very well. Okay. And then you also need to follow the instructions that is given. Okay. And yeah,
that's it.
That's it.
Okay. So the main reason why I'm interviewing you today is because I want us to compare care homes and NHS. Yeah. Okay. And I'm asking you because I know you've worked in a care home, in a UK care home, and you're currently working in an NHS. Is that right?
Yeah, that's fine. Yeah.
How long were you in the care home?
I was in the care home for 1 year 6 months.
1 year 6 months. Yeah. And how long have you been with the NHS?
That's 1 year and some few days.
Really?
Yeah.
1 year and some few. That's okay. Yeah. So if you've been at both places, you were at the care home for over a year, and then you've been in I think you have a fair idea of how they both work.
Certainly, yeah.
Okay. So today we are going to ask you of your view.
My view. All right.
Of your view about NHS and then care homes.
I'll try to be fair.
Okay. What was the reason that made you go to a care home from Ghana in the first place? What made you choose a care home when you were in Ghana?
So coming to UK, I had the option of going to NHS and then care home. But the most important thing for me coming to UK was to pass my OSCE. Okay. And I checked the NHS pass rate and the one company that's Four Seasons, their pass rate. Four Seasons had 100% pass rate.
Okay.
And NHS sometimes 70, sometimes 60.
Okay.
So I was like, let me go to care home and then, get my OSCE done. If I want to change to NHS, I can switch whenever I want.
Okay.
So that's what got me to the care home in the first place.
Okay.
Yeah.
And why did you decide to leave after 1 year?
Well, it wasn't my kind of environment that I enjoyed working. Back home, I was working in A&E, and switching to a care home that's adult nursing, it's just a very, very dramatic change. So it wasn't my kind of work. So
if you stay there for a year, I should say you were getting used to the routine there. So why did you decide to change?
I never got used to the routine there. I just was enduring. That's the word. I was enduring in the care home. I wasn't enjoying at all. So I was just looking for ways to live. My contract, I was bonded for 1 year, so I can leave after 1 year.
Okay.
But as within the 1 year, I was just looking for ways. So I wasn't so sure about the specific NHS trust to join.
Okay.
So that took a little bit of time.
Okay.
And when I got the right NHS trust, I joined right away.
Okay.
Yeah.
So is there anything you miss from the care home? Anything at all that you miss?
Nothing. Zero.
Nothing at all.
Nothing at all. I wouldn't miss anything. It's one of the regrets that I made in life.
Really?
Going to a care home, yes.
Really?
To be honest.
So you are 100% okay with the NHS?
Very, very okay.
Okay, in what way does the NHS beat the care home? In what way?
So with the care homes, you lose your clinical, experience.
Okay.
It's just giving oral medications. You don't give IV medications, and it's just sometimes wound dressing. And most of the basic thing at the care home is just care, offering care to people. Is that
not what nursing is all about? Offering care?
Not really. Depends on your field of experience and what you are interested in, your ambitions. So I was so much enthused with A&E nursing. That's acute care.
Acute care.
So I wasn't seeing acute care with care home setting. That's sometimes end of life, which is not my kind of thing. So
people say nurses in care homes make more money than nurses in the NHS. What would you say about that?
Yeah, to be honest, they make a lot of money, more than what we do make in NHS. But the most important thing for me is job satisfaction. You need to enjoy what you're doing, just not about the money. I wouldn't want to work in an environment where I wouldn't have a peace of mind, and I'll just always be watching my shoulders to see what if something goes wrong or what if something goes out. No. I want to enjoy what I'm doing, and that's exactly what I'm doing right now in NHS. Yeah.
I'm okay if you don't answer this question. If when you were in a care home for a month where you don't do any extra shifts, how much were you making? And in an NHS for a month where you don't make any extra shifts, how much do you make? Let's see the difference if it's that wide.
Do you want me to answer this question?
I'm asking. Feel free. If you don't want to, like, we just want to compare the pay. Like, how bad is it? How bad is the difference? Like,
I don't mind. So with care home, I was making like £2,000
without overtime.
Yeah, without overtime.
2,000.
Yeah, 2,000. Let's see, around that figure.
Okay, yeah. And at NHS, without overtime, how much can you make?
So with NHS, it depends. Depends on
without overtime, like
without overtime. So with NHS, you have enhanced rate. You get enhanced rate on weekends and Saturdays, and then if you work on night shift as well, you get enhanced rate. So it can go as much as 2,000 as well. That's for
if you're doing nights and weekends.
Night, weekends, make sure.
Other than that,
that's like 1,000, 6,000, 7.
So that means there is a difference. Like
there is a difference.
Because 400 is a lot.
Depends what you looking for. 400, yeah, but it's not worth your peace of mind and
Okay.
Yeah.
So if you were not in an A&E in NHS, would you still have loved NHS as much? Or it's just you wanting to be in NHS? That's
not just wanting to be NHS. Being in NHS. I wouldn't want to work in a ward. No, that's not mine.
So you're going to be an A&E nurse forever. That's what you want.
I've been thinking about going to critical nursing, but I'm still contemplating.
Okay.
I sometimes think it's gonna be boring.
Okay.
But I'm still thinking. At the moment, I'm very okay with A&E nursing.
Okay.
Yeah.
Okay. And being in a care home for 1 year and then moving to A&E, like the difference is huge. Like, did you struggle to settle in the A&E? Did you struggle to settle in? How was your orientation? You know, finding your foot there. How was it?
So I'll start with the care home. So when I relocated from Ghana to the care home, I didn't have much of training with the care home setting. Just thrown into the pit.
Okay.
And then you just have to find a way around it and then survive.
You didn't have orientation?
That's basic orientation, just few orientation.
Okay.
But I wouldn't call it orientation, to be honest. It wasn't that detailed, and then you wouldn't survive with that.
Okay.
But contrasting it with NHS, it's a very structured organization, and you know, you'll be trained for every single thing you do. You will need to be trained before you do it, because you know, because of litigation purposes, NHS always wants to cover its back, and they will make sure you are competent for everything. Even taking checking BM of patients.
You have to be trained to check BM.
You need to be trained before.
Are you serious?
Yes,
oh,
you need to be trained.
Okay.
Even before using the oxygen mask, you need to be trained.
Wow.
Yeah.
That's good.
With NHS, you'll be trained, and they'll make sure you are qualified before you deliver care to the patients.
Okay.
Yeah.
I see. So how did you settle? How long did your orientation take? How long did with the
so you have preceptorship. That's for 1 week preceptorship.
1 week.
Yeah, 1 week preceptorship. But within your first year, within the first 6 months is probation period. But within that period as well, you have a lot of training.
Okay.
And they'll be monitoring your competencies.
Okay.
So with me, within the first 2 months, I was a little bit slow. Okay. Because I wasn't so sure about a lot of things.
Yeah.
So I had to just take things slowly.
Okay.
But that is difficult as well in an A&E setting.
Okay.
But because of my previous experience in A&E,
okay,
I didn't struggle so much.
Okay.
It's just the difference is just because of the equipment and the machines that we use over here in UK than what we use in Ghana. Okay. So when I got used to those things, yeah, I was okay.
Okay.
Yeah.
And did you feel like, because people say that when care home nurses come to NHS, they look dumb, like they don't know anything, they look like they don't know anything. Did you feel like that, or did the staff there make you feel like that in any way?
No. So it's your I would say it's your mentality and your skills. Okay. If you have learned something like 2 years or 3 years ago, and because you change a setting to go to a care home and you forget those things, I would say that is up to you to forget those things. I didn't forget any of it. Even when I was in the care home, I was calling the residents, I was calling them patients. So I still had the hospital mentality in my mind stuck in there. And I always told my manager I would want to go to a hospital someday. So I was looking for opportunities while I was there. So I never got the care home setting in my mind. No. So
would you say now you are fulfilled with where you are? You have job fulfillment where you are now?
There is job satisfaction.
That's it.
And I come home excited and I'm looking forward to going to work every single time.
I see.
Yeah, and I'm even going to work tonight, and it's very lovely. Yeah, I'm looking forward to it.
That's okay.
Yeah.
So what's the difference between like the A&E setting in Ghana and then the A&E in the UK? Is there like a major difference, or is basically the same thing?
There's a major difference.
Okay.
In terms of delivering care, the human resource available. So within the A&E setting here, we have all the multidisciplinary team available for you to utilize them. Okay. So we have different sections of A&E. Okay. We have more acute place. Okay. Like resuscitation units. We have majors, acute majors, and other places. Okay. So if there is an emergency, if there is even a panic alarm that you pull, and you get help right there within, But back in Ghana, you have to just scream or just have to, call out someone. But
it's so true in the comment section.
Yeah, and there is a lot of doctors available as well. Back home, the doctors, very few doctors available. But over here, lot of doctors, and the waiting time to be seen is very, very short as well. So I would say there is, a little bit of difference in between the two. But the care we deliver is the same.
Almost
It's basic nursing care that we learned in school is the same thing.
Okay.
But the difference is with the availability of the multidisciplinary team and the equipment that we use. But when you are trained to use them, you're okay.
Of this, when you were changing employers, like what is the main? What's the procedure? What do you do if you swap from care home to NHS? What was the process of changing your employer?
So you have to NHS have a website for jobs. They have this jobs website where they advertise their vacancies. So you have to.
What's the name of the website, please?
That's Track Jobs.
Track Jobs.
Yeah, Track Jobs.
Okay.
They advertise all their vacancies over there.
Okay.
So you have to go through them and then you select the one you really like.
Is it jobs in the whole of UK?
Yeah, the whole of UK.
Oh, that's nice. Okay.
And different departments as well.
That's nice.
Yeah.
Okay. So when you get there, then you apply.
Yeah, you apply, and then you need to. Most of the NHS trusts would offer certificate of sponsorship, which you will need to apply for your visa or to change jobs. So you need to contact. You need to inform them that you would require certificate of sponsorship.
Okay.
And then they would proceed with that. So if you apply and then you get the job, not like you get the job. If you apply, you send your CV, they'll contact you. Okay. If they are interested, so they'll organize an interview.
Okay.
And then after the interview, if they're happy, they would offer you a job. And after that, you would also need to submit your references, and they'll do the background checks as well. Okay. And then if they're satisfied, they'll proceed with the COS. Okay. And after the COS, you apply for the visa.
So you apply for the visa whilst you are on your old visa?
Yes.
So does that mean the time you are applying, like how does it work? How does it work?
So your visa will still be there, but the minute or the date that is on the visa, on the new visa, that is when your new job begins. So you cannot do any other. If you quit your old job, you cannot do any other jobs until you start your new job. Okay. So that's what happened to me. Because I was so frustrated in a care home, I just quit my job 1 month before joining my new trust, and I was just staying home because I couldn't do any other jobs.
Anything.
Yeah.
So you have to tell your new employer the date you want to start. Usually,
they would give you options about the days that are available. Yeah. Okay. So you choose the one which is suitable for you. But sometimes most of them will tell you, oh, you need to start at this date. Yeah.
Okay. And then when do you send in your resignation to your old job? When is the appropriate time to resign?
I would say if you get your visa, that is when you need to submit a resignation. But you also need to remember you need to give at least 1 month, at most 1 month notice. Most of them is 1 month notice.
1 month notice before
depends
you
on
resign.
How long you've worked in your care home or in your trust.
Trust.
So your contract would stipulate how much advance notice you need to give. But for me, I gave 1 month notice even before I had my COS. So I resigned without having my COS. Okay. And then I was just waiting
for the COS.
Yes.
So
the COS, when you apply within UK, it takes just 1 day. So it doesn't take. It takes just 1 day.
1 day. That's nice.
Just 1 day.
And when you apply for the visa, do you send in all the documents that you sent when you were applying for your visa in Ghana? Would you have to send your TB and your IELTS, and would you have to do it just like the application?
No, you wouldn't need those things. I think you would need NMC statement of entry. You need statement of entry.
Of NMC.
You need your COS, and You need what else? Your passport details. That's basically just few things that you need. You don't need a lot of documents. No.
Okay.
Because the statement of entry covers the IELTS and the CBT and everything. So the statement of entry is quite enough.
Do you have to do it biometric as well? Would they call you for biometric? Yeah. They call you for biometric?
Yes, you need to do biometric. You need to book an appointment for the biometric registration as well.
Wow. So how long did you get a response, like the visa, when you applied?
So I did a priority one because I had resigned from my work. So within a few days, I got a visa.
Okay. So you advise people to always wait for the COS first before they resign?
Certainly, yes. But
okay.
If you have no other option, just like me, I was so frustrated. I had no option than to just quit. Yeah, I was very, very, very frustrated.
Okay.
So that's why I, look down on a care home with passion.
Please don't say that.
Not the people who work in the care home. Not the people who work in the care home, but the care home setting. That's not a setting for people to just work. That's my basic thing. I would say that's not a setting for people to work now.
Okay, so I'm going to ask you a few questions. You just answer care home or NHS, right? In terms of pay, which one has a better pay?
I would say NHS.
Don't lie.
It's the same.
Same.
It's the same. It's the same because of the contracted hours that you work. Usually the care homes will bond you for like 44 hours a week, which
I'm not doing 44, please.
So you do 40 hours, 39 hours.
Yes. Level of responsibility, which one has like more responsibilities, NHS or care home?
I would say care home.
Responsibility.
Yes, responsibility. You're responsible for a lot of things, and responsibility comes with risk as well. So with the care home, I'll use myself as an example. I was working in a care home with sometimes 21 or 22 residents, dementia patients. Sometimes I get one carer, two carers. So much responsibility, and I'm the only nurse. So if something happens, it's on me. I've taken responsibility of the patients. So if something goes out, it's on me.
It's on you.
So that's so much responsibility on you, the nurse, and you don't share any responsibility to someone else, just you.
Okay, it's your opinion. Job benefits.
Oh, come on. You shouldn't even ask this. That's NHS. You shouldn't even ask this question. That's NHS. When you get pregnant, I'm a man, so I'll not get pregnant. But when you get pregnant, come on. Benefits. So many benefits. Even sick pay. Even with sick pay, you are paid for your sickness as well.
Please, I'm also paid when I'm sick in a care home.
Most of the care homes you don't get paid for.
I am paid, but it's not that much.
Yeah, but with NHS you get your full
pay.
Yeah.
Okay. Annual leave.
I would say NHS.
Really?
Yes.
How
NHS.
long is the annual leave in NHS?
Depends on how much you served in NHS, but for me, I had 6 weeks and some days.
Really?
Yeah, 6 weeks and some days.
That's a lot.
268 hours.
That's
divided according to the contracted hours. So if you divide my contract hours, that's 7.5 divided by 270 something. That's like I'm getting 6 weeks and some days.
That's good.
Yeah.
Career growth or furthering your education.
Are you asking? NHS.
Okay.
Unless you want to be, a care home manager, then you stay with the care home. Yeah.
Okay. The rules. Which one has so many rules to follow? Like the do's and don'ts. Which one has like so many, like strict rules?
Strict rules. This is, I can't answer yes or no.
Okay.
With the care home, you are given liberty to do a lot of things, but that's too risky as well. You can lose your pin easily. That's the only place you can lose your pin even without realizing it.
That's in the care home.
Yes, in the care home. But with
once
NHS,
again, your opinion.
My opinion, I would say I'll go for NHS has rules. Yeah, they have a lot of rules, but it's good. It protects you. It serves as a protection or a boundary for protecting you.
Okay. Yeah. Last question. I'm asking for a friend. Are you single?
I plead the fifth.
What the hell does that mean?
That's the Fifth Amendment. So
We are not in US. It is not in UK here. We don't have that. I'm asking for a friend. Are you single?
Can you please skip the question?
Okay, all right. Thank you so much for coming.
Thanks so much.
I had a good time. Thank you. I'll let you know when it's ready.
All right.
Bye. Thank you.
Michael.
No.
Stop over here. I'll say it's the same because at care home they do more hours than your contracted hours. So if you should, because care home they do 44.
Yeah, I was doing 44 hours.
Yes.
I'm doing 37.5.
Yes,
So
if you end up doing 44, you may also earn the same amount of money.
Let me tell you something. Even if I add bank shifts to it, come on, do you think it'll still be like roughly the same?
Yeah.
So I would say